you have a few minutes? After learning about David needing to get hospice services, I decided I should learn more about what help is available. Did you know that if someone is age 65 and up and facing a terminal illness, that Medicare probably will pay 100% of their hospice costs? You ask why? Well, hospice is set up to make people comfortable, pain-free, and to stop trying to do heroic things to their body once they realize that a cure is not going to happen. Someone's doctor can refer them to hospice. Be careful though, every provider likes to suggest a particular hospice, and there are thousands. So I urge people to find their own. Don't just take the first recommendation. There are over 4,300 hospice care organizations in the USA. There's real competition amongst those providers to get that income stream, so be careful. Some are much better than others. Look at www.nationalhospicelocator.com and then research. Realize that once someone picks a provider, it can be changed if you're not happy with the services. Did I tell you that only about 52% of eligible people even sign up for hospice? That's crazy. There was a big comprehensive study in 2019 by the American Geriatric Society that estimated that 2,700 Americans die every single day. And I don't mean drop dead, but they've been ill and then they die. But they got no help from hospice. Are people afraid of the word hospice? Do they think that agreeing to getting help to manage their pain and their medical issues and their emotional needs and their spiritual needs will cause them to die sooner? The U.S. has such an underutilization of hospice. And the bottom line is hospice does keep people out of hospitals and unnecessary and unhelpful procedures, so it actually saves the U.S. government, I mean Medicare and Medicaid, money. 80% of the people hospice serves are over age 65. That makes sense. About 1.4 million patients get help from hospice yearly. No. I'm not talking about palliative care. I'm just talking about hospice. I wish more people understand the truth about hospice. It's a joint federal and state program to help people get support and attention to keep them pain-free when they have a terminal illness. The diagnosis is that they won't live more than 6 months. Hospice even will give some care, a chance for loved one who's been being the caregiver. Hospice will go take care of the patient for up to 5 days as a break. If a doctor recommends you for hospice, at some time the patient might say, I don't want hospice anymore. That's fine, especially if they hear there's a possible cure. They can discontinue the services. They can even request that hospice leave, but then months later they could ask that they come back. I urge you to be familiar with www.hospicefoundation.org. Once you get in the site, there are a lot of helpful points, but one that will really get your attention is to click Take the Hospice Knowledge Quiz. You might be surprised as to what you thought you knew and what you may not. There's a lot to get right. Learn about it, because you might be able to help somebody. It should be more common conversation. Bye. Don't forget to help my ego and subscribe. Click like. Thanks, y'all.